But last night, Trump seemed to break with his health secretary's anti-vaccine rhetoric.
Look, you have vaccines that work. They're just pure and simple work. They're not controversial at all. And I think those vaccines should be used. Otherwise, some people are going to catch it and they endanger other people. And when you don't have controversy at all, I think people should take it.
At Thursday's Senate hearing, some of Trump's fellow Republicans joined Democrats in grilling Kennedy on his extreme vaccine positions and promotion of public health misinformation.
I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
The Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant?
You also told Senator Wyden at the outset that you didn't want to take vaccines away from people. I would say effectively we're denying people vaccine.
So let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Joining us now, Dr. Paul Offit, director of the Vaccine Education Center at the Children's Hospital of Philadelphia. He was recently removed from participating in a vaccine advisory committee for the U.S. Food and Drug Administration. Dr. Offit, thanks so much for joining us this morning. Can we get your take on the grilling of RFK, especially by Republicans, and what you think this means for his future in this job and for public health for all Americans?
I think it was encouraging. I know that some of those senators had seen polling from actually a Trump-friendly polling group showing that most American parents want vaccines. Most American parents find vaccines to be safe and effective, including Republican parents. And I think that may have influenced people like Senators Cassidy, Senator Barrasso, Senator Tillis, who took up the mantle of challenging RFK Jr. for his false beliefs. So I take heart in that.
You know, one of the things that, as we were talking about this segment, the team, is the schedule, right? So COVID, for example, there seems to be, and he talked about this a little bit in the hearing, confusion on whether or not people can actually get the vaccine, right? There was this guidance that came out from the CDC that was like 65 and older, and when you're really young, that means that insurance company, you tell me if I'm wrong, that insurance companies are going to look at that guidance, take that guidance, and pay for it or not. Pharmacies will or not give people the vaccine for free. And the confusion over this seems like the biggest problem that you could possibly have. We should all understand when and how we can get vaccines in this country. It's 2025.
Right. I think confusion is the point. I think that's Robert F. Kennedy Jr.'s goal, is to make it confusing. And I just had a series of emails this morning from parents and others saying, I'm having trouble getting vaccines. I mean, there are pregnant women who have emailed me and saying, I can't get a vaccine when pregnancy is clearly a high-risk condition for severe COVID. And I think he has made this very hard. I really wonder whether RFK Jr. understands what's going on the ground. I'm not so sure he does.
Yeah.
And I just want to play a soundbite from Senator John Barrasso, a Republican who is also a doctor who spoke out against RFK on Thursday.
I support vaccines. I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership at the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on.
He makes a really good point there. Who should Americans be relying on, Dr. Offit?
Well, you can't rely on the Advisory Committee for Immunization Practices anymore. RFK Jr. fired all 17 members, claiming falsely that they were in the pocket of industry, even though they clearly had the kind of expertise and experience that we needed, and none of them were in the pocket of industry, and replaced them with 7 people who don't nearly have that expertise. And so all the medical and scientific organizations I know no longer trust the ACIP, and by extension, no longer trust the CDC. So now we're looking towards these consortiums, like in the Northeast, and in the West of states that are providing information, trying to make sure that insurance companies will cover vaccines that should be recommended, although some may not be, like, for example, the COVID vaccine for pregnant women. So I think that's what's happening. The American Academy of Pediatrics now has its statements about what vaccines children should get. And I think people are now looking to those other organizations. But I think it's a tough time.
You know, Doctor, while you talk about folks looking to these other organizations to figure out what they should do, you have these, you know, I guess democratic states kind of banding together and say, this is how we're going to operate. The CDC was the gold standard of all of this, right? The gold standard for the whole world, really, right? Like about how vaccines should operate. I want to play some sound for you from Florida, which has taken a different tact, obviously, than these Democratic governors.
Every last one of them is wrong and drips with disdain and slavery, okay? Who am I as a government or anyone else, or who am I as a man standing here now to tell you what you should put in your body? You want to put, you know, whatever different vaccines in your body? God bless you. I hope you make an informed decision.
There are a lot of things that the government tells people not to put in their bodies or to put in their bodies, just for the record. What does it say to you that you have the Florida Surgeon General and, by extension, the governor of Florida saying, you know what, we're not going to require vaccines for kids that go back to school? What kind of danger does that put the rest of the kids and their parents in as school starts now?
So what he's saying is if you want to catch and transmit a potentially fatal infection during an epidemic, that's your choice. And we're currently in a measles epidemic that's bigger than anything we've seen in 33 years. There's probably about 5,000 cases of measles in this country. 3 people have died, including 2 healthy young children. That's the first child death in this country since 2003. So if, for example, there was an outbreak of measles in Florida, and there was an outbreak in a high school in measles in Florida last year, he's saying, you know, I'm just going to stand back. I'm not going to use the 2 things that I have that are most powerful in stopping that epidemic: quarantine and asking you to get a vaccine before you can enter school. That's what he's saying. And, you know, I was living through the 1990-1991 Philadelphia measles epidemic when we had 1,400 cases and 9 deaths. And the only way we were able to stop that was by insisting that children had to be vaccinated before they went back to school.
And Doctor, I want to ask you about a new Wall Street Journal report that came out yesterday, where reporting that we're to expect HHS to link autism to Tylenol use in pregnancy and folate deficiencies. Quote, Health Secretary Robert F. Kennedy plans to announce that pregnant women's use of an over-the-counter pain medication is potentially linked to autism, in a report that will also suggest a medicine derived from folate can be used to treat symptoms of the developmental disorder in some people. People familiar with the matter said. What is your response to this news report, and can you provide some sort of fact check and context about studies that have been done on this exact issue previously?
Well, so Allison Singer from the Autism Science Foundation just put out really nice monographs making the point that autism isn't just one thing, that there are a number of predisposing factors. There's a genetics to autism that involves about 20% of those who have autism. Maternal and paternal age at the time of conception is certainly influential, especially paternal age. There are drugs that one can take during pregnancy, like valproic acid, which increases the risk of autism. There are maternal risk factors like obesity and diabetes that increases the risk of autism. And so we'll see what kind of data he has, but certainly there was a Journal of the American Medical Association study that showed recently that Tylenol or acetaminophen was not associated with autism, and I think RFK Jr. is about to make that claim. In any case, he's the last person I would trust to give good scientific data, because he's been a science denialist for the last 20 years. When data show, for example, that the measles, mumps, rubella vaccine doesn't cause autism, he simply doesn't believe it. Or that thimerosal, this ethyl mercury containing preservative that was in vaccines up until about 2000, he doesn't believe it. Has a book that just came out called Thimerosal, Let the Science Speak, where the science doesn't speak at all. I don't trust him to get the science right.